I just wanted to do a follow-up video on the surgery last night or yesterday afternoon. It was at 2 o'clock. And how I'm feeling right now. So, surgery went well. The only bad part was when they put in the epidural. It shocked me. The first push kind of, that was sucked, but it wasn't ridiculous. So the procedure took about an hour once they actually got started, and it was great. My doctors were amazing. All 11 or so crew members that were in there, nurses and ultrasound techs and other doctors were great. I laid there with one headphone in, listening to Imagine Dragons while I was laying there, so they were making me a believer, I guess. And yeah, it was great. So what they were able to do was separate all of the major blood vessels between Asia and Ava. They also wanted to do, I forget what it's called, but there's like some extremely tiny blood vessels that can form and reconnect, and they were trying to get rid of all of those. But they missed like one or two tiny ones because the laser went out, which the doctor was totally ticked about, for good reason. But there's this extremely small chance of those membranes actually forming over the next 17 or so weeks until I deliver, or it could be earlier than that. So last night I got back in the room, was in bed pretty much all night, because I had a catheter and waiting for the epidural to completely wear off to make sure I could use my legs, which is a good thing. And everything worked out fine this morning. I was on contraction monitor all night, and no contractions were felt. I didn't sleep great because I couldn't get in a good position because I couldn't feel my legs a bit, and and I have a little soreness, not actually at the incision site, but kind of around it, because there was a little plastic tube with a camera and a little laser inside me, so the moving around has me just a little bit sore. My incision is tiny. It's probably right, that's right, about that long. So, and it's like kind of below and to the right of my belly button. So when I get this bikini body back, it won't look terrible. So, let's see what else. So this morning, came in. I got the catheter taken out. Everything went fine with that. Ate breakfast, really good food at this hospital. Good hospital food. One of the doctors came in to check on me, and I headed up to ultrasound, and the ultrasound went great. Fluid levels are evening out really well. Ava has about 2.7 centimeters around her, and Asia has 2.5. Before, it was Ava had just barely over 1 at the highest, like 1.6, and Ava was at a point she was over 10. And normal is between, they like to see over 2 and under 8. So I'm at almost 3 for both of them. And that was actually shocking for Ava because they got her down to 6 centimeters during the procedure, but leveled out throughout the night. So that's really, really good. What else? The doctor said that Dr. Moore, amazing again, um, said that he believes that it was from the separation of the membranes. I mean, of the blood vessel, but it could be also that there's a little tear in the membrane. So I'm not going to explain this a lot because I'm going to say it all kinds of wrong. But there could be a little tear in the membrane, and some of the fluid that's outside the membrane is showing up inside of her sac. But he's really confident that it's actually fluid inside Asia's sac that he's seeing, because her bladder was normal size this morning, looked good. We could barely see it on the ultrasound before, and because we saw it really, really good. Ava's heart was enlarging, and it was actually shrank down already to normal size, because it's not pumping already. And I wanted to share, we got some amazing pictures, like these pictures inside my room. It's just crazy the way technology is. We got a picture of Ava's hand and her little mouth, and you can see her tongue in there. And they tried to get her nose, but during her little procedure, pretty much, she was doing cartwheels and flips, and they couldn't get they couldn't get it. They were on her nose. They're like, picture of her nose, and she moved. So I guess she's not down for the paparazzi, I guess. But yeah, we already know she's gonna be our little wild child. Every ultrasound, she's moving all over the place. But I can't say enough how pleased I am, how pleased we are, my family is, with the staff here, Dr. Moore, his crew, my nurse yesterday, Jennifer, was amazing. The nurses I've had since I've been in the room, Jordan, Rochelle, they've been great. My ultrasound tech, Katie, she's great. Yeah, so everybody's amazing. Yeah, and like I've said before, we're not completely out of the woods yet, because we still have several weeks, few months till the baby's ready to come into the world. And I mean, anything can happen, but both myself, my husband, and the doctor are extremely confident of how things are going to work out. My next appointment is next week, Wednesday, so we'll see if everything's still looking good, and if it is, I'll be moved back to my local MFM that I see in Biloxi and sometimes New Orleans, depending on the schedule. Again, thank you all for your support, your prayers, text messages, everything. I'll keep you all updated. Thank you so much. Pray for our girls.